test, and my son was healthy, so and happy, so it's good.
Wonderful, wonderful. All right, well, welcome everyone. Thank you so much for joining us on your lunch hour for today's Facebook Live chat on gastroenterology. My name is Colby Reed, and we are live at the Gastroenterology Department at the Portland Clinic downtown offices, and I'm joined by Dr. Albert Kine. Dr. Kine, thank you so much for joining us today.
Hi, Colby. Thank you. Thank you to you and your audience for talking about GI health. It's something that I deal with all the time, and I love talking about it.
Excellent. Well, when you talk about GI health and gastroenterology in general, it's kind of a broad term and really a broad practice for the Portland Clinic because we're here in the fabulous downtown location, but you have multiple offices where you do a number of different procedures. Can you, just for kind of at a high level, talk to our viewers about gastroenterology, maybe some stats or data points that would be of interest?
Sure. Well, gastroenterology deals with the whole GI system. That's everything from the esophagus down to the rectum, and also the associated organs like the liver, the gallbladder, and the pancreas. And here at the GI department, each of us GI doctors takes care of them, and we have offices here at the downtown office, out in Tigard, and out in East, which is on Sandy. We do procedures here and as well as at the Tigard office.
Interesting. Now, part of the reason why we're having this conversation today is because March is Colorectal Cancer Awareness Month. Can you share maybe some stats or data points that people in Portland would be interested to know when it comes to health of the colon or colorectal cancer?
Yeah, colon cancer is unfortunately very important. Amongst the cancers, it's the second leading cause of cancer death. And unfortunately, not enough people are caught early enough. About 1 out of 3 people that develops colon cancer will die from it. Now, we know that colon cancer is a very preventable disease if we can screen for it. And that's why during this month, as well as throughout the year, we in the GI department love helping people get screened, particularly by colonoscopy. That's one of the main ways we do that.
Interesting. It's such a mixed message that it's one of the most, it sounds like it's a very treatable disease if it's caught early, but some few people know to get screened. So my guess is that there are risk factors that are involved and that certain people are maybe at a higher risk of the disease and should be getting screened earlier. Can you talk a little bit about those risk factors we should be aware of?
Sure. I mean, I kind of block them in 2 distinct groups. One is things that you can't change. Family history definitely increases your risk for colon cancer as you get older, and that's why we start screening, particularly at age 50. For African Americans, there is some increased risk there, so a lot of societies recommend starting at age 45 for them. And then there are a lot of things that you can change no matter what your age or race is, and that would be avoiding tobacco, avoiding obesity, and avoiding too much red meat. We think that a high vegetable, low red meat diet really will help.
In terms of colon cancer and colorectal disease, what are some of the warning signs that we should be watching for this checked?
Yeah, that's important to ask because my mother, she had colon cancer and she really had no symptoms. And that's part of why we recommend talking to your doctor and always getting screened at the right age. Certainly there are some symptoms that if you tell your doctor, they will direct you to my division. Any bleeding, any anemia, or a change in your stool pattern where before you would always have maybe a regular bowel movement, but now they're thinner in caliber or not coming very often, or associated pain. Any changes in your bowel habits, that would be another reason to talk to your doctor.
Okay, so let's say I notice a change in my stool pattern and I go to my GP and my GP says you need to go see Dr. Kine or one of the other gastroenterologists. What is the screening process that's involved?
Sure. And I know a lot of people are very concerned about colonoscopy, and over the years, it has gotten a lot easier. Colonoscopy is probably the main way we do colon cancer screening, although there are some other methods. Colonoscopy is probably the best way because not only can we look for colon cancer, we can look for other colon diseases and also prevent colon cancer by removing polyps. Most cancers in your blood count, sometimes people don't realize they become anemic. And anemia is also one big reason that we check for colon cancer.
Interesting. Well, we want to thank everyone for joining us today. If you're just tuning in, this is today's Facebook live chat from the Portland Clinic's Gastroenterology Department at the downtown office. I'm Colby Reed. I'm joined by Dr. Albert Kine, and we're talking about gastroenterology health as part of Colorectal Cancer Awareness Month. I've almost gotten through the entire thing without screwing up that word. Now, when we've talked a little bit about some of the risks and the health problems that are involved, but when it comes to a healthy colon, what does that look like?
Yeah, well, I mean, a healthy colon is one that can do its job, which is absorb water as well as hold stool for when we need to release it. So I think the main thing for people to watch out is to make sure that they are observant of what's going on with their bowel patterns. Make sure that they're having regular stools without pain. And I know it's uncomfortable for some, but they need to make sure that they look and that they know that their stools aren't black, which means some blood, or red blood, which obviously is blood. Being aware of your body is an important start of general health.
And how important is fiber to dietary fiber to keeping the things flowing, keeping the process moving smoothly?
That's a good point, because a lot of people do not get enough fiber in their diet. We recommend around 30 grams fiber per day, and your average American gets about 15. So fiber not only helps things stay moving in your GI tract, there are actually other benefits. For some it helps reduce weight, and for some it also helps reduce cholesterol. So fiber has a lot of advantages for the body. And sometimes, because people don't get enough fiber in their diet, I often recommend, just as a baseline, get a fiber supplement, whether that be something natural like psyllium husks, or a brand name like Metamucil or Citracel. That's always good, just to help, in addition to a normal healthy fiber diet, get enough fiber in there.
Now, when we talk about diet, we've been hearing a lot of chatter on the Facebook page in particular, as we've been talking about this month, about dietary sensitivities, things like people with celiac disease or a gluten intolerance or a dairy problem with dairy or something like that. Are those dietary issues a cause for concern, or will those heighten our risk of colorectal disease?
Yeah, I mean, celiac disease is very important to know about, because it is more common than we used to think, and it can cause GI symptoms, it can cause diarrhea, and it actually can cause constipation in some people. So it's important for doctors to think about. The good thing that we know is that celiac disease does increase your risk for colon cancer, but it does increase your risk for other problems. So you should definitely, if you have any warning signs or a family history of that, talk to your primary care doctor about it and have them perhaps send you to us.
What about some other areas of health improvement that could have an impact on the colon? For example, we're always told that we need more sleep, that we need better exercise, we need more water. Are those all things that can impact the colon and the colorectal system?
Yeah, actually, it's interesting. A study came out relatively recently saying that maybe people that have not enough sleep have an increased risk for colon cancer. That was an early study, so the future data will help us identify if that's really a true risk factor. Exercise helps benefit the GI tract in a number of ways. First, it helps increase your metabolism, it helps keep things moving, so exercise can help you stay regular. And then exercise helps you avoid obesity, and obesity can be a risk factor for both colon polyps as well as colon cancer.
Now, one of the other things that we were talking about, you mentioned kind of as a warning sign and things are maybe amiss, is your bathroom habits and how often you're going and what that looks like. Is there a standard of the average adult male should go this many times per day or this many times per week, or is it kind of person by person?
Well, it is important to know that there's a range. That's why it's important for listeners to really observe what the pattern is like in general. One person can go every other day, and that is considered normal, and other people can go twice a day, and that's normal. As long as there is no pain or bleeding, that's completely fine.
So if one of our viewers, as we just kind of wrap up here, if someone is, either hasn't been checked for colorectal disease or is experiencing some symptoms that we've talked about here and is maybe a little concerned or confused, what's the best first step for them to take?
I think the best first step is really to talk to the primary care doctor. I think the primary care doctor can help them look for and discuss some of their risk factors, as well as check labs or other things that would also denote risk factors. And if needed, then they would send them to our department. I think that they should realize that because colonoscopy is so easy and colon cancer is so common, that they really need to take their GI symptoms seriously. Another study came out recently that said perhaps even below 50, the rate of colon cancer is getting more common amongst people in their 30s and 40s. Again, that's an early study that has some corroboration already, but it's something that even younger audience members should take note of.
I don't want to put you on the spot. Is that something that is because of diet changes or lifestyle changes, or do they have a correlation for why they're seeing a higher increase at that younger age?
We don't know. I think some people think that it's partly because we've been pushing for colonoscopy for people above 50 over all these years. Colonoscopy is more understood by the general community and more easily approached by patients and for doctors. So I think that some of the increased risk some of the increased rate is that younger people are talking to their doctors more about what's going on in their GI health and therefore getting screened or getting evaluated and then getting their colon cancer found earlier.
Interesting. Great. Well, that was very helpful information. Thank you so much, Dr. Kine, for taking the time with us today.
My pleasure. Thank you.
And thank you all for tuning in with us today. Of course, if you have any questions about colon health, colorectal health, or colorectal cancer, please feel free to contact the Portland Clinic. Visit theportlandclinic.com. I'd be happy to set you up with an appointment, and we look forward to having you for our next Facebook Live chat. Thanks so much and have a great day.